Hello, everyone. First, I'd like to welcome you to our webinar, Leveraging Medicaid to Expand Health Services in Schools, an update from Promising Future Learning Collaborative. We're excited you all could join us and hope that you enjoyed this webinar. My name is Rochelle Davis, and I'm President and CEO of Healthy Schools Campaign, which is an organization that's hosting today's webinar in partnership with Trust for America's Health. We'll tell you a little bit more about Healthy Schools Campaign in a couple of minutes, but first I wanted to quickly review some basics for today's webinar. Today's webinar will run approximately 1 hour, and a recording of the webinar will be available to view later today. We'll email a link of the recording, and it will also be archived on Healthy Schools Campaign's website by the end of this week. Also, at the end of the webinar, if you could take a minute to complete a quick survey about the webinar, we'd really appreciate it. We're going to save 15 minutes at the end of the webinar for a question and answer session with our speakers. You can ask questions by typing a question into the questions box located on your control panel and click on the send button. Feel free to send questions through the questions box at any time during the presentations, and we'll answer as many as we can during the Q&A session at the end. This webinar will update you on the important initiative we are convening with the U.S. Department of Education, CMS, and Trust for America's Health. The Healthy Students Promising Futures Learning Collaborative is a national learning collaborative with 13 and growing state teams to support them to developing state strategies for expanding Medicaid-funded school health services. The Learning Collaborative recently completed its December meeting, and joining me today on the call are 3 colleagues who have been working closely with the collaborative. Joaquin Tamayo from the U.S. Department of Education, Ann DeBasi from Trust for America's Health, and Lena O'Rourke on behalf of Healthy Schools Campaign. For those of you who are not familiar with Healthy Schools Campaign, our work is based on the simple and common sense notion that healthy students are better learners and that health and wellness should be incorporated into every aspect of the school experience. We work at a school, community, and district level to foster school environments that support student health. We empower parents, principals, teachers, and community members with the knowledge and skills to bring health and wellness into the classroom. We advocate for district policies and practices for a strong policy environment. We work to build the capacity of schools, the district, and communities to support sustainable and meaningful change. We've had the opportunity to take some of the lessons learned and elevate them to a national policy stage where we co-chair with Trust for America's Health, the National Collaborative for Education and Health. Healthy Schools Campaign and Trust for America's Health have a long-standing concern and interest in making sure that schools have the capacity to deliver school health services. There has been a confluence of events over the last several years that have brought together several streams of work to support the delivery of health services in schools and ultimately brought together the Healthy Student Promising Future Learning Collaborative. Much of our work is focused on the free care rule. While it sounds like a good thing, the free care rule prevented schools from receiving reimbursement for health services they delivered to Medicaid-enrolled students outside of the student's IEP or for EPSTD services. After 6 years of advocacy, we were successful in getting the Obama administration to clarify that schools can, in fact, bill for services they deliver to Medicaid-enrolled students, even if they are not part of a student's IEP. Since this was clarified in a letter to Medicaid directors almost 2 years ago, we have been working to inform schools, health providers, and others about those changes and to build the capacities of states, school districts, and the community to expand Medicaid-funded school health services. In addition, ESSA, or the Every Student Succeeds Act, was signed into law just about a year ago and provides an opportunity for schools to fundamentally reimagine their approach to education or to amplify and build upon efforts already going on in states or districts. ESSA continues the tradition of other education laws, beginning with the Elementary and Secondary Education Act of 1965 and continuing with the No Child Left Behind Act, of highlighting opportunities and approaches to increase and ensure excellent public education opportunities for all students. ESSA provides a framework for states and local educational agencies to identify and address barriers to student learning, such as health challenges, by including these factors in accountability systems, school improvement, planning, and resource allocation. State and local education agencies are also required under several sections of ESSA to engage stakeholders and increase community, family, and parent engagement to ensure that students have continuity between the health and school environments, between the community and school environments. These partnerships can include healthcare providers and the health sector, including Medicaid. Other drivers outside of the school and in the healthcare system has also contributed to the fast-paced development of the Learning Collaborative. This includes a system-wide focus on value and quality in the delivery of healthcare services, as well as a shift to managed care for children and families. When these forces merged, it became clear that education and Medicaid together had the opportunity to make concrete and significant progress on behalf of children's health and to examine ways to deliver services in schools. Obviously, we need to acknowledge the upcoming change in administration. I'm sure that you share my concern about the values driving the Trump administration and its proposals related to health and education. At Healthy Schools Campaign, we are moving forward with all of our state and local work and watching carefully the new administration's plans. With that, I'm going to turn the presentation over to my colleague, Lena, to provide the background on Medicaid free care policy. Her presentation will provide a strong foundation for understanding the opportunities facing states.
Thank you, Rochelle, and my thanks to the Healthy School Campaign and TFAH for their support of this collaborative and for allowing me to participate today. I'm going to give you a quick overview of the federal Medicaid policy that's really driving this conversation. And you'll keep hearing us talk about this free care policy, so it's important to know what that is, what it means, and what's happening. And it is going to frame up a lot of the rest of this webinar, so it's important to know. You need to note, though, that every state's Medicaid program is pretty different in terms of its structure, its financing, its benefits. So we're going to be talking pretty big picture here, but how Medicaid plays out in each state varies dramatically. Now, if Medicaid is not your space, don't feel too overwhelmed by my slides and my presentation. This is just the beginning. There are lots of resources, including all of us on this call, a wide range of national organizations who are ready to help, and the state Medicaid agencies themselves. So just consider my presentation an introduction to the free care policy, but hopefully a kickstart to getting involved and to breaking down the silos between Medicaid and education to improve student health. So with that, a little background. This conversation is happening because of this new federal policy that came about in 2014, which is brand new in terms of federal policy. You see, before 2014, schools could only bill Medicaid for services provided to a very limited number of students, including those with IEPs, individualized family services plans, and students served by the Maternal and Child Health Block Grant. Schools could not largely bill for any general education Medicaid enrolled student. So this means that school districts around the country do work with and bill Medicaid, but this interaction has been historically very limited to this specific set of students, though very successful in practice. Next slide, please. Then in 2014, CMS, which is the federal agency that runs Medicaid, issued new guidance and reversed this old policy. The new guidance gives states the ability to get federal Medicaid funding for all Medicaid enrolled students. In other words, it opens the doors for schools to bill Medicaid for health and behavioral health services provided in the school to any Medicaid enrolled student. And this is what's known as the free care policy reversal. So according to this new policy, schools will be allowed to bill Medicaid if the student's enrolled in Medicaid, if the services are covered by Medicaid in their state plan, if the services are delivered by a qualified provider, as outlined in the Medicaid state plan, and the states have a lot of billing and oversight mechanisms in place as well. Next slide, please. So the impact of this policy reversal has really been a springboard for states to talk about the delivery of school health services, and has opened the door for discussions and partnerships between Medicaid and education, and between schools and advocates and parents, and has encouraged new thinking about how schools and Medicaid and education agencies and healthcare entities can work together to improve student academic and health outcomes. There's a lot that states could do, if they choose, with this new flexibility, including possibly increasing overall funding for school health services, thinking about additional services that are needed to match currently unmet student need, and investing in the healthcare workforce. Next slide, please. If a state wants to move forward with expanding the delivery of Medicaid services, it does need to do a few things. This isn't something that just flips the switch and goes on. First, they're going to have to assess their need, an unmet need, and their capacity to expand the services for Medicaid enrolled students. And they're going to have to look at what's called their state plan to determine if they actually need to amend it. And this state plan you'll hear a lot about, sometimes it's called a SPA. It's a formal agreement between your state and the federal government that describes how the state administers its Medicaid program. And submitting a SPA is a formal process between the state and CMS, but a pretty common one. So in these conversations, the states will be looking to consider the best mechanisms for expanding access to services, which may include some really innovative and new ideas to increase access to services, including looking at managed care and school-based health centers and other delivery models, in addition to investing in the school-based health services they already provide. Next slide, please. 2 states have already done this. 2 states have already looked at their SPA to expand. A number of states are considering this. A number of states have considered alternate mechanisms, but I want to highlight these 2 as examples because this work is going on and I think this shows it. Louisiana has implemented a SPA to implement the free care policy reversal. And what happened was in 2011, Louisiana transformed its whole program, whole Medicaid program into managed care. And as part of that, it wrapped school nurses in and allowed them to provide services to Medicaid beneficiaries with an IEP. So that was the first step. But now, with the reversal of the free care rule, Louisiana now allows the school nurses to be reimbursed to bill for the services provided to all Medicaid enrolled students. So they use their SPA and their flexibility to expand to all Medicaid enrolled students. Next slide, please. California has also submitted a SPA on the free care policy, and they did this about a year ago. And their SPA proposal is much more expansive than Louisiana, so they've taken a slightly different route. Key components of the California proposal include expanding eligibility so that all Medicaid enrolled students have access to the existing services, but they also expand the types of school-based services that will be covered by Medicaid. So in addition to expanding eligibility, they're expanding the type and scope of services. And they're expanding the type of providers who can bill for Medicaid in the school. And so they have taken a comprehensive approach towards school health using the SPA. This is not approved yet. This is still pending at CMS and pending approval, but it gives you an idea as well of how expansive and how big these type of opportunities facing states are. And with that, I'm going to turn it over to my colleague Joaquin, who is going to just jump off this free care springboard and talk about how the Department of Education and its partners have used this as a catalyst to develop its learning collaborative out of all this activity and where we are. Joaquin?
Thank you, Lena. I appreciate it. And thanks everybody for joining the webinar today. We're very excited to share the information about our Healthy Students Promising Futures Learning Collaborative. I do want to kick this portion of the webinar off by just explaining the genesis for a moment of this entire effort to integrate state education health systems. So at the beginning of this year, 2016, Secretary King at the Department of Education and Secretary Burwell at HHS released guidance, basically outlined the argument about why we believe closer integration between education and health is so important for our children. As Rochelle said earlier this afternoon, we understand the research all points to the fact that healthy children are better learners, and better learners simply grow up to become healthier adults and more successful adults. So we wanted to outline that, create, make sure the research base is known among the field, and really identify opportunities across our sectors that could be enacted immediately without any new authorities, without any new policy changes at the federal level, so that states and local systems could begin to the process of integrating and bringing health and education much more close and meaningfully in the lives of our kids. And so we launched together, HHS and Ed, the Healthy Students Promising Futures Initiative in January 2016. With that initiative, we launched a toolkit. You can actually just Google Healthy Students Promising Futures Toolkit, and you'll find a nice PDF downloadable copy of that. And within that toolkit, we outlined 5 high-impact opportunities that states and local systems could take advantage of, like I said, immediately to begin to improve the health and wellness of all of our children. Number 1, make sure that all of our kids are, if they're eligible, enrolled in Medicaid in the marketplace in CHIP. Number 2, and the point of our webinar today, leverage as much as we can reimbursable health services, particularly school-based health services for our children. Number 3, take advantage of Medicaid-funded case managers at school sites. Number 4, do everything we can to ensure nutritious and healthy school environments for all of our kids. And number 5, where you can as well, create meaningful partnerships, particularly leveraging the Affordable Care Act's community needs assessment protocol to ensure that schools and school systems are included in the needs assessments that local nonprofit hospitals have to conduct. So with those 5 high-impact opportunities, we believe states and local communities can much more closely integrate education and health, not only improving health and wellness among children, but also student achievement. So really, it's an argument for both the education and health sectors to work more closely together, and we're so excited to have the support of Healthy Schools Campaign and the Trust for America's Health, and actually a whole national coalition of states and nonprofit organizations that are now committed and dedicated to making sure this happens across the country. Next slide. So one of the leading drivers of this work is our Healthy Students Promising Futures Learning Collaborative. As I'm sure the folks on the webinar know, systems integration is not easy. We're talking about breaking down silos between systems. We're talking about brokering relationships among leaders and professionals, in many cases who haven't met each other, who don't know what each other does, though we're all working for children. And so as we discussed how to actually enact the Healthy Students Promising Futures initiative in a meaningful way at a national level, we consulted the principles of adult learning and some best practices from across the country and created what we call the Healthy Students Promising Futures Learning Collaborative. So it is a group of states that has convened a state team that includes leaders from the state education department as well as representatives from local education agencies and leaders from the state Medicaid agencies, as well as any nonprofit, foundation, or private group within that state that plays a critical role in student health and wellness. And we asked state teams to collaborate, to broker those relationships, and then join other state teams from across the country to form the Learning Collaborative. And so again, it's led by Ed, HHS, Healthy Schools Campaign, and TFAH. And we convened our first meeting in July of this past year. We just finished our second meeting. And now we have 13 states. Next slide, please. 13 states that are part of the Learning Collaborative. And as you can see from this slide, California, Colorado, DC, Massachusetts, Minnesota, Mississippi, New Jersey, New York, Ohio, South Carolina, Tennessee, Virginia, and Washington State. So just looking at the states that have joined together, it's not just one region of the country, it's not the East Coast or the West Coast, the South or the North. It really is a coalition of states that represents, really the entire country. Included in these states are over half of all Medicaid eligible or enrolled children in the country. So this has really become a powerful group of states but are all committed to not only expanding health services in our schools, but actually, I think more importantly, rethinking the learning experience, rethinking the schooling experience for all children, to include a direct and critical focus on health and wellness. Health and wellness isn't just a thing that happens. It isn't just another sort of a side issue in schools. It is a central issue these states are recognizing. And so they've come to the table now twice in most cases and are really rethinking not only, as Lena discussed, the tricky Medicaid issues, but also things like use of time, use of space, nutrition issues, training of teachers and educators, cross-sector partnerships, really rethinking, from the ground up how we think about school, what school's for, and then how we can leverage the time that children spend in school, which is quite a lot of their year, to improve their health and wellness and to ensure joy in learning and student achievement over the long term. Next slide, please. So the goals of the collaborative were pretty straightforward, and we got the states on board, and so they began developing and implementing really a vision for their state that integrated health and wellness. And after they uncovered and articulated that vision, began to articulate strategies to scale up within their context. And as Lena said, every state context is different, particularly as it relates to Medicaid. So we gave them the time, the space, the technical expertise and assistance to think, what are the strategies that work for their states? And that was a tremendous value add for each of the states. They also individually identified options for delivering health services, discussed issues like how to assess student needs, what are the types of interventions and services that make sense for their schools and for their state and for their Medicaid context, as well as what are the kinds of partnerships that are important to leverage within the state context to uncover and define the efficiencies that we could create through the integration of education and health. Another important aspect of this conversation has been, as Rochelle mentioned earlier, how to leverage new opportunities to support student health within the Every Student Succeeds Act. So if you don't know much about the new education law, the new federal education law, you should know that every single state has to submit a state plan in the next 6 months that articulates how they're going to support large-scale student achievement. And so we're working with them to identify really important opportunities to use data and to rethink funding streams and uses of funds to improve student health and wellness in the same way that they want to improve student achievement. We're also helping them to think through their technical assistance models, to think through how they structure Medicaid reimbursement, how they structure the policy that enables that to happen, how they support local education agencies to enact the changes vis-a-vis the new free care change policy, or the change in the free care policy. And so it's happening at a state level, but bringing the states together, they're able to think innovatively, they're able to, bust those silos across their states, interact with folks from across the country, gather new ideas, test out new ideas with colleagues without lots of, pre-existing notions about how things should happen, and come to a greater clarity about a way forward for their particular state team. Next slide. So like I said before, we had a first convening in July. Fantastic, over 100 folks from across the country, 10 states joined us, and in December we had the states return and 3 new states joined the collaborative: Virginia, Minnesota, and Washington State. We bolster the Learning Collaborative by conducting regular check-in calls with the states. So we support them. It's really a one-on-one process with us, TFAH, HHSC, and the Department of Education working together to understand how it's playing out in the state, to understand more and more about their local context. It's really actually helping us develop a stronger Learning Collaborative over time, improve the technical assistance offerings that we're able to deliver through the Learning Collaborative, structure meetings much more effectively, and bring national partners from across the country to the table so that they can provide resources where they may exist, and tools and opportunities for further growth and capacity building at the state level. So it really has developed into a national coalition that includes the federal government, state agencies, and a whole complement of national partners led by Healthy Schools Campaign and TFAH. Next slide. So successes to date have been tremendous. Not only have these teams self-funded their teams to come to the Department of Education twice. We really didn't have a whole lot of money to do this beyond the assistance from Healthy Schools Campaign and TFAH and what they brought to the table. And so that really told us that there was a desire and a hunger to get this work done, to do it well, to do it in concert with other states so that we were working together. No one was doing it all by themselves in this work. And we're tremendously grateful to the states for making that investment. There's been tremendous buy-in in terms of the check-in calls. People are coming back to the table, bringing their problems, you know, sort of not feeling too scared about putting something on the table that's really tricky to work on. We're trying to get rid of the mythologies around Medicaid and reimbursement so that they can take that next step and feel confident that what they're doing is absolutely in the best interest of children. And then we're helping them think through what are the longer-term policy and practice goals that they want to set for their state. And we're hoping that, again, by busting the silos across states and across our sectors, we're able to generate the kind of enthusiasm and excitement and commitment to long-term systemic growth and change that we know is going to be required so that all of our kids across the country, no matter where they are, no matter who they are, have the opportunity to learn and grow in healthy school environments, become successful adults, become healthy adults, and really can contribute you know, to this country over the long term. And again, from the Department of Education and the Department of Health and Human Services, we're so grateful to Healthy Schools Campaign and Trust for America's Health for being the national leaders in this space. We couldn't do without them, and we look forward to seeing Healthy Schools Campaign and TFAH lead this work beyond the Obama administration. So with this, I'm going to turn over to my colleague, Ann.
Thank you,
Trust for America's Health.
Have to start by saying we couldn't do it without your leadership too, so we truly appreciate it. As Joaquin said, I'm with Trust for America's Health. TFAH, as we're known, is a not-for-profit, nonpartisan, evidence-based policy and advocacy organization, and we're completely dedicated to making disease prevention a national priority and helping every community be as healthy as it can be. So I have what I think is a really fun part of this presentation today to talk about what we've learned, and we look forward to hearing your questions and comments about what we've learned so far. Before I start, I do just want to mention, as Joaquin and Lena have said, we only just started in July. So these really are early lessons learned, and we look forward to digging a lot deeper on our journey with the states. Next slide, please. So we've got 4 buckets I'm going to talk about in terms of our lessons. And again, this is based on our early work with the 13 states. So the 4 buckets are federal policy support, building partnerships and cross-agency teams, assessing unmet student need, and identifying innovative strategies to meet those needs. Next slide, please. So starting with what's core to all of this work between the intersection of health and education is building the partnerships to do the work together. And in this case, since we're engaging states, there's of course cross-agency teams that have to be developed. So as mentioned, the teams do include participation from Medicaid and the state education department as well as local districts. And what are teams doing? What have we heard? Well, they're building these partnerships. Many of these folks hadn't worked together previously, so they're now meeting regularly and engaging those above them to know what work they're doing in collaboration. That has greatly improved the state-level communication across departments. They're developing shared vision and policy goals, as Joaquin mentioned. And we do that actively, working during our collaborative meetings, as well as making progress on those goals and further defining the action plans between meetings. And that's with the support of not only the partners and leadership, but also, as Joaquin mentioned, a robust group of national partners that are also equally engaged in helping the states move forward. They're identifying elements of a total cross-agency budget, so really working together to see how investments in one department will benefit another And in the case of health and education, as Rochelle mentioned in the beginning, we know that there's benefits in both directions, since healthy students are better learners, and healthier school environments and more educated students are healthier over their lifetimes. And finally, they're identifying funding sources to seed or to scale up delivery models that might already exist in their site. And we know what a challenge that always is. But I will say, I think what we know needs to be done is to bring together different funding streams to meet the needs. So while we have a focus on Medicaid today, I want to recognize that Medicaid is a matching program, and education funds also go into these partnerships. Next slide, please. So the second budget is federal policy support, and both Rochelle and Lena teed up a lot of the changes that are going on that are opening doors for these partnerships to flourish. So our state teams are really learning about what are the different models for providing Medicaid services in schools through nurses, specialized instructional support personnel, through school-based health centers, partnerships with Medicaid providers in their community, be they private providers or federally qualified health centers or hospitals or universities. There's such a variety of providing care for kids that are enrolled in Medicaid. So they're learning about them, particularly our education colleagues. They're untangling really what does this free care policy reversal mean, as Alina did for you earlier on the webinar. And they're getting guidance directly from our colleagues at the Centers for Medicaid and Medicare Services, where they're really providing guidance directly to the teams, both in the collaborative meetings and in their communications directly with states, particularly those that might be preparing the SPA. So some states will need to submit a state plan amendment if they want to start billing additional services in school by school. So literally if the school system itself is going to be billing Medicaid for services, as Lena described. And so they're figuring that out. It's a process that they need to go for. What are they going to apply for? What types of services? What providers will be providing those services? And how will the reimbursement work? So they're seeking clarification on that billing and reimbursement. It's not easy. Developing these SPAs, but also thinking about how they connect with these other partners who are already approved Medicaid providers and can come on site to deliver a wide range of services in schools. And they're exploring this new law and how, as stakeholders, they can engage in the development of the plans at the state level and really leverage all the various components of the new law. For example, professional education or grants that could help to promote a healthier school climate and culture. So they're looking at those opportunities. Next slide, please. On a more technical note, they're not just going to put some health services in schools, not that willy-nilly. They're really thinking about, this does take extra effort, and it is new. So they want to make sure that they're focused in on the highest priority needs. So they're getting a better understanding of what is already being provided in schools. Some states have a robust system now with school nurses and other specialized instructional support personnel already available in many of their schools. Other states, not so much. It might vary by region or locality. So they're understanding the range of services. Where are their school-based health centers? Where are their partnerships already in existence where a mobile van might be coming to the school? And then once they understand what's already being provided, they're trying to figure out, well, what do their students need and what is not available to those students easily accessible in their communities. So in other words, getting down to the bottom line, what is it most important for the schools to provide that they're not already? And then they're assessing the opportunities. How can they better align their goals with Medicaid's goals? As we all know, Medicaid is a tremendous program, but it doesn't meet all the need that's out there. So they're looking at what the access gaps are in their communities and states and how the school might be a delivery site for filling those access gaps. We'll say this is an area that we talk a lot about. We're learning from states that are ahead of the curve, but there are certainly challenges to identifying data sources, collecting those data, analyzing those data, and in particular to sharing data between the health agency at the state level and the education agency. And I think those challenges are well known, and we'll be happy to share with you the tools that have already been identified by our partners at HHS and ED, and know that this will be an area that we'll be continuing to work on, how we can facilitate data sharing between agencies. Next slide, please. So for the final bucket, before we turn to your questions and comments, of course, it's a learning collaborative. We're trying to learn from each other and learn together. So states are identifying innovative strategies, and that's through their work with their partner states, and also, I think, importantly, informed by the national partners that are coming to the table to teach them about these other models that are available out there. So, for example, the school-based health providers, teaching them about how school-based health centers work, or the nurses explaining how the different range of services that nurses could provide above and beyond what they might have provided under the previous free care policy. In addition, teams are considering the role and opportunities of managed care. 95% of the kids are enrolled in managed care. It's a reality in the world today, and will not change even if the Affordable Care Act is repealed. So we will still have managed care. How does school health fit in, or how is it outside of that system, and how can it be better integrated? They're looking at these various delivery models that I've mentioned, and a lot of this is based on what assets do they already have in their communities, and how can they tap into and scale up those assets and make partnerships with these providers. They're identifying innovative models. We've heard about how one state partners with their university to bring telehealth services to the school, where the nurse is at the school facilitating that telehealth appointment with another type of provider who's literally still sitting in their university setting. So it's very exciting about how we can get services, particularly into rural areas, through telehealth. Other innovations include mobile health and various different partnerships, and I have to say I don't even think we've unearthed all the innovations yet. And then we talk a lot about what the health needs of students are. So for example, some chronic diseases keep rising to the top, such as asthma and diabetes, particularly health conditions that students have to deal with during the day, like asthma or getting your insulin if you're diabetic. And then also behavioral health needs. That's a big concern to a lot of the states. They want to be able to address students' behavioral health needs, particularly early on, to try to help that student be as healthy and developmentally and academically successful as they can be over their lifetime. And schools have the opportunity to do that. So next slide. Turning now from the early lessons learned to how you on the phone, and we really appreciate everybody who's signed in today, can get involved with this Healthy Students Promising Future State Learning Collaborative. First of all, connect. So all of you who are working out in state and communities, you can connect with these ongoing efforts and teams in these states. We're going to need to continue to educate. This is a process where we're learning each other's language. We're developing trust. We're creating mutual goals and visions and action plans. So there's a lot of need to educate and advocate for action in the states and even in the school districts. We can continue to foster these relationships between Medicaid and state education departments. I mean, we know that the worlds are transforming in both health and healthcare and in education through the implementation of the new law. So it can be difficult to find the time to develop and foster these new relationships, and you can help with that. A big area where we really could use your help is providing technical assistance, both to policymakers and to these state teams, and probably to us too, those of us leading this collaborative, we don't know all the ways we can meet these student needs. And those of you that have been working out there in the field could teach us a lot about the innovation that's occurring and how we can spread those best practices to others. As I mentioned, data collection and sharing is definitely a challenging area with respect to both technical challenges and protecting the privacy of students and patients. So you can help us in identifying data sources to assess what unmet needs exist for students in schools so that we can target our efforts and make sure that we address the most important unmet needs. You can help us develop resources and advocacy materials. All of your perspectives are really welcome and very important to the cause. And importantly, provide training on the partnership development, because bottom line, it is about partnership. And on that note, I just want to end by really recognizing Healthy Schools Campaign. The Trust for America's Health has been so honored to partner with Healthy Schools Campaign for 5 years now, back to 2011 when we worked together to issue a report called Health in Mind, and since 2014 working together to co-lead this national collaborative on education and health. It's truly been a pleasure, and I think we've made great strides, and we couldn't have done it at all without our partners at the Federal Department of HHS, but also importantly, education. And so thank you again, Rochelle, Lena, and Joaquin. And I'll turn it back over to Rochelle to moderate the rest of the webinar.
Well, thank you, Anne, for your leadership on all this work and for your kind words. I'm going to get right into questions here, and the first question is for Joaquin. Is there an opportunity for additional states to join the Learning Collaborative? We've gotten a lot of questions on how participants on this call, and how they can get involved in this collaborative.
Well, that's a great question. Well, the answer is yes. What we do ask of states who are interested in joining the collaborative is that they create a state team as the other states have done. So we have asked states to bring the most relevant and responsible folks from the State Department of Education, and that's different in every state in terms of who's responsible for health and wellness in schools. The lead partners in the state Medicaid agency who are responsible for youth and student health, as well as representatives from local education agencies who can be supportive and who can help the state think through how it should work and play out on the ground, as well as other relevant partners within a state. So as long as the state is able and willing to bring that type of a coalition, state-wide coalition into the collaborative, then we're more than willing to welcome a new state into the collaborative. It would be really hard without all those pieces, I think, we believe, for a state to get the most out of this experience. But assuming that basic structure, we believe that it would be worthwhile for any state to join and figure out how they can more closely integrate education and health for their kids and for their schools. In terms of how to or who you can contact, I imagine, I'm not sure if we'll give contact information at the end of this webinar, but those representatives and myself, at least until January 20th, please reach out to us, and then we can begin a conversation about joining the collaborative.
And this is Lena. If I can just tack on at the end here, I think what we have all felt was just such an outpouring of support from the states. It's these states were not selected to join. They self-identified to join, and I think we expected a smattering of interest and from the state teams, but it surpassed what we had been hoping. We did get a question about how the states were selected, and I just wanted to call out that these were states who actively pulled their teams together and pulled in and continue to work together to bridge some gaps in what they know about each other and how they talk. But it was self-motivated to join the collaborative.
That's right. Thank you for clarifying that, Lena. Yeah, no selection. This was self-selection, and this really is a grassroots movement among states to do this work.
So thank you, Joaquin and Lena. So, and then just to emphasize, Healthy Schools Campaign and Trust for America's Health will be continuing this collaborative moving forward while the new administration is transitioning and getting established. We don't want to lose any of the time or momentum that has been developed. And there will be contact information at the end and in the follow-up emails. So this question is for Ann or Lena, and it's what type of providers is California allowing and for what?
Sure, this is Lena. That's a great question. And I'm going to answer it in a sort of vague way, actually. So I'm going to answer it from the big picture and then I'll talk California. So every state currently has a list of providers and services that are covered by the Medicaid state plan. And it's a whole list. And if you're interested in California's, the California School-Based Health Association has a great paper that has a great chart of exactly what services and exactly what providers. And similar resources exist across most states. We could figure those out. What I think is notable about California, though, is that what California is doing is expanding the types of providers. And I think that's probably what this question refers to, is like what kinds of new providers would be available to be covered by the state plan amendment. And it's a whole range of them. So I'm just going to pick a couple of the types of new ones. I don't want to get into too much detail on those because, again, this is pretty California specific. But it's things like they're expanding, in addition to the services they already provide, they're expanding, in addition to the providers they already cover, they're expanding to licensed physical therapist assistants and occupational therapist assistants and into more personal care types of providers. So you can see for a state that is interested, there's a range of services and providers already there where you're expanding the eligibility to those providers. But there's a whole world of types of healthcare providers who could be considered based on the needs and interests in the state. Back to you, Rochelle.
Thank you, Lena. So can you, and again, Lena or Ann, can you give examples of what kinds of services school nurses are providing that can be reimbursed by Medicaid thanks to the free care policy?
Sure, this is Ann. I'm happy to talk generally and then give a specific example. So in general, it will depend on whatever the state submits to CMS in their state plan amendment. But anything that is game to go in that amendment, if one is even needed, is anything that the school nurse is licensed to do in that state and is covered by Medicaid under the EPSDG program. The Early Periodic Diagnostic Screening and Treatment Program, which is pretty much anything a child should be screened for and is found to need. So it is very broad. As a specific example, in Austin, Texas, there's a partnership between the Children's Hospital and the school district, and they have teams of registered nurses and school health assistants, and they provide a range of services. Of course, there's those sick visits that probably all of us made to the school nurse at one time or another, minor injury care, emergencies, and the such. But a lot of what the school nurses do is also care for chronic health conditions, as I mentioned earlier, and behavioral health conditions. They administer medications. They train other staff to administer medication. They identify students needing immunizations, notify the parents and get the proper forms, and then provide those immunizations. And some schools that have robust systems of school nurses have almost 100% immunization rates. They refer out to different services in the community. They do state-mandated screenings for hearing, vision, for risk assessment for type 2 diabetes. They do care for allergies, asthma, seizures. They might do counseling around pregnancy, health education for students. They are there in case there's a communicable disease outbreak. They work with the local public health authorities to contain that outbreak. And of course, they're there in case there's a need for any crisis intervention because of any threats to student or staff or any disaster or emergency. So I don't think I even hit it all. And that's just one example in Austin, Texas.
So thank you, Anne. And just to kind of add to that, the free care, the clarification that the free care rule doesn't apply to schools, excuse me, means that any services that are already covered by the state's plan that a school nurse or another health provider would deliver to a student, even if it's not part of an IEP, is then potentially eligible. So it may not extend the type of services that are already covered by Medicaid. It just extends it to an additional group of students in a location, which is schools. So the next question is there a tool for a needs assessment and assessing student unmet needs? So Anne or Lena, do you want to take that on?
Well, this is Anne, and then Lena, please chime in as well. I don't know that there's one specific tool, although the best resource for that, I think, would be the Center for Disease Control and Prevention, or CDC's Division of Adolescent School Health, which has developed a number of tools. School nurses as well are in the process of developing very assessment tools that can be used across all school nurses. But in addition, I just want to point out that this is something that schools don't have to do on their own, because a lot of health providers are already required to do health needs assessment. This is a real area where there's opportunity for partnership so that schools don't have to take on a new data collection and assessment, but rather work with, for example, the public health department that already does surveillance and needs assessment, or the local nonprofit hospital that's required to do a community health needs assessment, or a federally qualified health center that has to do a needs assessment for their funding. So one thing we don't want to do is proliferate the number of needs assessments that are already going on in the community. So I think it's a real opportunity for schools to partner with others that are already doing that in their community.
And this is Lena. I'll just echo behind and amplify that, because I think what has been interesting in talking to the state teams who are part of the collaborative is what they're struggling with is how to identify what unmet need they need to quantify first, and then how to bring all of these various data sources to bear, and how to make a compelling data picture and to present a unified analysis of it across and between the silos of Medicaid and education. And I think that's a role as advocates we can all play too, in helping identify the sources of existing data, as Anne has already said, in lifting up the importance of a holistic look at the available data and where there might be gaps in data. And I think as the state tables broaden in terms of their participants and their advocacy strategies, that's a role we can all play. And everyone will know a slightly different piece of the puzzle, which I'm a Medicaid person, not an education person. So I have been, I know what the Medicaid side brings to the table, and I'm, people keep having to translate to me between the two silos, and that's, I think, the experience at the state level too. And so the advocates play a critical role in helping bridge that debate and that divide, particularly around data and needs assessments. So I thank you for bringing up that question, and I think there's real opportunity for engagement there.
Well, thank you, and I think we have time for one more question. Are there any templates or prototypes for the opening of existing plans to transform and innovate the delivery of services in a more comprehensive and effective way?
Well, I can start that, Anne, and then you can jump in. This is Lena. I think it's a really excellent question, and maybe a really good place to wrap up, because the short answer is it's a little tough to develop, a pro forma template to fill in, because each state is extremely unique in terms of the structure of their Medicaid program and the structure and needs of their education system and what strategies will work, and thinking broadly and expansively about how to fill the unmet need, either through leveraging this free care policy or looking more broadly to partner with community providers, as Anne has already touched on. I think, though, we are thinking about and learning from the states that are actively pursuing using Medicaid how to do that. And I think there's a lot of interest in best practices and states learning from their colleagues and their peers, which is one of the core goals of this collaborative, to really lift up what are the best practices, what's worked, what are the challenges, how we have approached it. I don't know, Joaquin or Anne, what you'd add to that about how the states are coming together to talk about the barriers and their strategies, but I think that's where we're finding a lot of success.
I completely agree, and the only thing I will add is that, I think this can be a fear area where states are afraid to open up their state plans for some unintended consequence might occur. And we've been able to, as I mentioned, bring in our CMS colleagues who have really tried to allay any concerns in that regard and have really opened their door and said, we want to talk with states that are taking this approach. Remember, this all was spurred by CMS reversing this policy, which indicates that, the door is open, and now states have to walk through it and have that conversation with CMS. So I think we've learned that it doesn't have to be as scary as it might seem.
And I'll only add that the fear and the sort of mythologies exist on both sides of the house, both within education departments in terms of IG audits and what they can reimburse for and bill for, and then also on the Medicaid side about the unintended consequences of opening up the SPA. And so really the Learning Collaborative is meant to break through that by having folks meet in person, come together, learn who their colleagues are, figure out these problems together with information and support, and arrive at a conclusion that moves their state forward to support the health and wellness of students.
Well, and that I think is a great way to wrap up this webinar. And again, thanks to Lena, Ann, and Joaquin for sharing this very important information with everyone today, but for all of the work and leadership that you have shown. So we look forward to working with all of you to advance these important goals. This webinar, again, has been recorded and will be posted soon for you to share with your colleagues. To learn more about Healthy Schools Campaign or Trust for America's Health, please check out our website, sign up for our mailing lists to stay involved and get the latest information. Email addresses are provided, so if you have any specific questions, we look forward to hearing from you. So thank you, and we look forward to working with you in the new year to advance student health.